Hey guys, so Michelle and I did this project on behavioral interventions, and we'll kind of go over a little bit different types of them. So Michelle will go over the first three, and then I'll go over the last three. So to start out, I wanted to talk about what a behavioral intervention is. So this is an intervention used to facilitate behavioral change in various settings, and typically we see this in the school setting because of the field that we're in. So it allows students to also generalize their skills, the skills that we teach them, the new ones, and then put it into place into different areas like at the home, in the community setting, stuff like that. And the creation of an attainable behavioral goal to elicit a positive behavior. So a lot of times we see problem behaviors in the classroom, and these are things that we're trying to do to elicit positive behaviors versus those negative and sometimes aggressive and sometimes really frustrating things that we deal with in a school and in a classroom. And then why we should use them is because it provides a much better means for an alternative to discipline. We don't want to be just suspending kids for the heck of it. So rather than doing that, we should try and use our efforts and our training and knowledge to be able to use an intervention plan instead. So, and then we also want to teach kids more socially appropriate behaviors. So that's really important because we don't want our kids to going out in the community and learning negative behaviors at school and then generalizing those versus the positive ones of the community.
So now that you know what a behavioral intervention is and why it is used, the next slide is going to talk about the purpose of behavioral interventions, and following that, there will be examples of behavioral interventions that me and Sunny talk about, as well as studies that have been done based on these interventions and how they have worked. So, as Sunny mentioned, behavioral interventions provides an alternative to discipline methods. Behavioral interventions also provide support for students. It addresses behavioral issues that may be interfering with a student or student's performance, for example, academic performance. It is geared towards increasing student success and helps teachers understand how to work with children that present with behavioral concerns. The implementation of proper behavioral interventions is very important because a student displaying behavioral problems impacts the performance of not only his or her peers, but also affects their own academic performance. And part of providing supports and interventions is making sure that all students are able to achieve success inside and outside the school. So, what are structured breaks and why? Structured breaks, they provide students with hyperactive behaviors or individuals sensitive to increased stimuli. A break where the student, he or she, can gather themselves and bring themselves back to like a neutral level. It allows also children time to cool down so that when they enter back into school activities or whatever work that they were doing prior, they are at a neutral level with their peers. Structured breaks are also important for children without hyperactive or any behavioral concerns. And this is because a child who is becoming disruptive will impact how other students around behave. Usually, this is what happens. And this will influence the academic achievement of all students or jeopardize the academic achievement of all students. Therefore, it is important that you shouldn't ignore a child who is clearly uncomfortable or displaying aggressive or hyper behaviors. Behaviors don't even have to be really aggressive. A child may show nonverbal cues, such as they could be like covering their ears to avoid noise during a really loud time, for example, like a lunch period where there's so many people in one place. Some children might be really sensitive to the noise, and so they might hide under the table or cover their ears or put their head down because they just feel so uncomfortable with what's going on around them, and there's way too much stimulus. So it's best that they be taken out of that situation where they feel uncomfortable and feel fearful, and go to a place where they feel more safe and they're allowed to cool down a little bit. Um, Teachers should definitely make note of this, but really any staff in particular, because once a child or children are outside of the classroom setting and in a setting such as like the lunch, like cafeteria, there are a lot more people than just teachers standing around. There's a bunch of staff there. And so I think it's important for all staff to make note of any children who are having any behavioral issues or any nonverbal behavioral issues and quickly help the child that is in need, which will in turn help other students that are around there. Okay, so there are a couple of steps that a teacher or an instructor can take when implementing structured breaks for a student. Um, the first step would be to make sure you explain to the student how the structured breaks will work so that they know what is expected of them, and to make sure to ask them if they have any questions, just so you know that they know what is expected of them. The next step, or actually one of the beginning steps, would be to make sure that there already is a safe place where the student can go during his or her breaks, where you know they wouldn't be in any harm's way. Um, Another step would be to gather material needed, such as a break card. This would be good for individuals who are nonverbal and are more visual learners, so they have a way of knowing when a break is about to occur or when they're allowed to go for their break. And also, another important piece of material would be to have a timer. Timer would help the teacher or instructor know when a student has just gone for a break and when the student is supposed to be back from a break. So a break could be 5 minutes, and the student would be expected to come back within the 5 minutes. And if the student is not back within the 5 minutes, then the teacher would have to go and look for the student and talk again with the student about how structured breaks works, because if the student didn't come back, they may not have understood how structured breaks are supposed to work. So when should we implement breaks, or structured breaks? Well, in terms of when, we would implement structured breaks when at each correct interval time, because if you look at the name itself, it's called structured breaks. So the breaks are not just thrown around here and there, they're structurally intervaled breaks. So it can be, as mentioned earlier, every 5 minutes, every 10 minutes, um, depending on the intensity of the behavior as well as other factors that have to be taken into consideration. And this is based off of the teacher's observations and other collected data. Um, but the other parts to implementing, when to implement breaks, would be when you see a student who is clearly having aggressive, confrontational, or argumentative behaviors. A student with ADHD who, may be displaying like hyperactive behaviors, or ADD. A student with disruptive behaviors. Disruptive doesn't need to be aggressive. Disruptive can mean just talking to peers over the teacher, interrupting the class lesson, talking over other students, um, just taking the attention away from the class activity or the lesson. Um, Another thing to look for is if a student is becoming overwhelmed. For example, if there's too much stimulus, too much noise in the classroom or in other areas of the school, like the cafeteria. Emotional outbursts. So this can also be aggression to like a really angry child, or it could be just a child who is in tears and crying, and also fidgety behaviors. So can't really sit still, needs to repeatedly get up and move around the classroom constantly. Again, very hyperactive student, um, has difficulty staying in one place. So when you look at all of these different factors or clues, these are good indicators of a student who might, find make use out of having structured breaks where they're able to um, release any sort of hyper behavior, and then when they come back to the classroom they're more at a neutral level and they're able to go on with their work and continue their task. Okay, so the purpose of this study was to understand if there was a correlation between classroom breaks and the students' behavior as well as physical activity. The study took place in the year 2013 to 2014 and was a mixed model. 6 elementary school districts were used in California. And based on the findings of the study, they were positive. Students' behaviors improved with the implementation of structured breaks as well as overall physical activity. So, the purpose of the study was to investigate the relation between problem behaviors during academic instruction and to implement an intervention called Breaks Are Better. And the study used 3 elementary school students in Pacific Northwest. Um, so during the study, there were observations made. The researchers decided to observe each of the 3 students 2 to 5 times per week, and these observations would occur for 20 minutes. Um, and based on all of the data collected and their findings, it was found that teachers and students, they found that the breaks are better intervention was valuable and also helpful, but the researchers believed that the results, although positive, were not significant enough. And so they believed that there would need to be more research done to support the hypothesis to say that implementing breaks were helpful for students who were going through or having behavioral concerns. What is a token economy? How do we integrate it? Is there evidence to support it? These are the questions that keep me up late at night. A token economy is a behavioral intervention that focuses on providing positive reinforcement. This is done by giving incentives after agreeing on a condition. Every time the student follows the conditions of the token economy, he or she receives a token. Token economies are great because you can manipulate the strength of a behavior by either increasing or reducing the rewards. As the child shows more and more desirable behaviors, you can change the frequency of your token economy. This way, the child is not always expecting a reward. So, how do you integrate an effective token economy? Because, I mean, not everyone understands how important it is to know how to do the steps to integrate a token economy properly. If it's not done properly, this totally defeats the purpose, and the student will just basically be getting rewards, um, and will be getting rewards when they're not supposed to be getting rewards. So it's important that these next few steps that I talk about are done properly, so that way you're doing what you're supposed to do to reduce a behavior, um, or reduce like disruptive behavior or any kind of negative behaviors that are affecting the student's academic performance. So the first thing is identifying. So what you want to do is you want to identify the behavior. What are you looking for? What is the targeted behavior? Because a student will be displaying all sorts of behaviors throughout the day. So you have to exactly pinpoint what behavior you're looking for. And this is usually where you do a lot of observations and collect a lot of data, and analyze the data to understand and decide on what exactly you're looking for. The second part, which is more of like the activity area, would be to determine what would motivate the student. Can an item such as food, or can it be like an activity such as 5 extra minutes of playtime? So you're basically looking at what the reward should be, but you're also looking at whether or not the reward will actually motivate the student, because sometimes students, they won't care. You'll show them something that they can get, if they, display proper or appropriate behaviors, but a student won't care unless it's something that they enjoy and they like. So you have to come on a common ground and get on the same page as the student and find something that you know you're able to use and will motivate the student. The third thing is you can have teachers do surveys. So the surveys would be to look for potential motivators. This actually kind of helps everyone in general when you're trying to do the second part, which is trying to determine what would motivate the student. This will help narrow down what activities or items can be a reinforcer, so it kind of just eliminates wasting a lot of time, and is more straight to the point. And then the fourth part would be determining the number of tokens. So you determine how many tokens should be earned each day, and slowly you can like increase then decrease tokens as the child neutralizes and starts having less behavioral issues without the expectation of a reward. So rewards are great, and I think it's mentioned somewhere else in this presentation too. I talk about how you can use tokens as a way. I don't want to use the word to manipulate, but you're basically manipulating the strength, not the student, the strength of a behavior. So as a student continues to display positive behaviors, um, you want to not have them always think that there's a reward in the end, because that would also defeat the purpose of having a token economy system. So you would decide on when you should change the frequency of the token and the intervals of when a token should be given, how many tokens should be given in a day, and make sure you keep track of whether or not the student is continuing to display positive behaviors, or if the student is retreating back into old behaviors once you have changed anything related to how you have given the student tokens and rewards. So the last part would be discussing um, with the student this entire token economy, which actually is really the first part, the first thing you want to do. So you want to inform the student. So I'm going to reverse this. You should definitely talk with the student beforehand on what is expected of them, so they know what they need to do in order to get the quote unquote rewards. Um, and how they can get it by using the tokens, and what behaviors they should be displaying and when, which would be all the time, because they're positive behaviors, um, and discuss this with the student, so that way they have a fair chance at um, you know displaying good behaviors. So for this study, the purpose was to investigate the relation between token economy and social reinforcers on academic achievement. to determine which works more effectively. So it would be whether social reinforcers work better or if the token economy is more effective. And so the study was experimental by pre-test, post-test with a control group. The studied group were males with intellectual disabilities in the ninth grade from selected high schools, which were junior high schools. And the study took, it was 1 year, so it was from 2009 to 2010. And based on the study, their findings, it was found that compared to social reinforcers, students with intellectual disabilities achieved higher academic success when using a token economy. So, in this study, the purpose of the study was to investigate the effectiveness between multiple behavioral interventions. They looked at token economies, response cost, and then they also looked at how both would work together as a combination to manage behaviors in the classroom. The study used two rural elementary school classrooms. Didn't really say how long it occurred, like the study occurred for, but the findings were that implementing the token economy alone resulted in a similar effect in comparison to the baseline and combination condition. So the token economy by itself actually was similar to what you would get if you combined it with response cost. Results were positive, and children with behavioral concerns showed a much more greater positive improvement in their academic achievement, and classroom engagement also improved. So, what is training? Training is a behavioral strategy slash intervention that's used to teach complex behaviors by breaking them down into smaller sequential steps. This is usually used with children who have autism. There are two methods. So there's forward training and there's also backwards training, um, which could be either or could be selected based on what you were looking for in terms of the child's behavior and what you're targeting. Um, so when you're trying to utilize the training, there are several things that the instructor or the individual who is assisting in the training with the child, there are a few things that a teacher, for example, must consider and do. First of all, they got to make sure that they analyze the desired behavior. Then they got to be able to break it down into steps. And then the plan is to teach these steps until they become routine. So once the child learns step one, and this becomes almost automatic, then they will learn step two, and then they will learn step one and two in that order, and it'll just keep on repeating. So the following slides will discuss this in a little more detail on the steps and how to implement this type of intervention. So how would you do forward chaining? Well, the first step would be to teach the first step of the chain to the student. So the person teaching would be the instructor. Um, and then the second step would be that once the first step is learned by the student, the teacher will teach the child the second step. The second step will follow step one. Step two will be added to step one. And then by the third step, the student would have learned step one and step two in sequence. And so the child will be taught the next step, and then the third step will be added. So the third step will occur after step one and step two in sequence, which is why it's called forward chaining. until the behaviors become routine. So that was forward chaining, and backward chaining is basically the same thing except in reverse order. So this time for backward chaining, you would have the last step taught and completed independently by the child. The teacher assists the child in the step before the last step, so the second last step, until this step becomes learned. Then the child is taught how to do the third last step, and so you just keep going in reverse order. So in this study, the researchers studied the effects training would have on children with autism spectrum disorder through a video model. So it was a little bit different from other studies because they incorporated video modeling. Um, this study involved one female student with consent, one boy with consent, and then there was one boy whose parents did not give consent. Um, and social skill workshops were run by two therapists, and the study used multiple baseline design. For the one boy that whose parents did not give consent, his name was obviously not mentioned or anything like that. He was not used for much of the data when it was released. The duration of the study wasn't mentioned, and the findings of the study showed that using a video to assist in change behavior helped individuals increase their gross motor abilities, suggesting that video modeling is an effective way to teach students gross motor skills. Although I think that there needs to be more research about this because this is just one study, but it was interesting to read nevertheless. So the purpose of the study was to investigate and help reduce aggressive behaviors in adults with ASD. Um, the individual, there was only one individual used in this study, so I don't know how well it could be generalized. But the study itself used chaining, a task analysis, and a fading procedure. The study was an ABAB withdrawal design. It didn't state anywhere that I saw when I was reading it how long the study lasted for, but there was a 1 year follow up. And based off of the follow up and the overall results, the combination of a 10-step task analysis along with chaining and a fading procedure actually did help the individual manage their aggressive behaviors and also make routine of their job. Because the individual used in the study, I think he was like a truck driver or something like that, but it helped him neutralize his behaviors, and by making his life more routine, he was able to work throughout the day more effectively.
All right, guys. So I'm going to be talking about some different stuff. One of them is going to be a little bit more in depth. Um, so I'm going to be discussing task analysis, differential reinforcements, and social stories. I want to discuss a different variety of interventions on my end, since we work with all grades, and some interventions may not be socially appropriate or age appropriate for certain age groups. So for this, I will be referencing a lot from pretty much the Bible of ABA, the Cooper, Heron, and Heward book, as well as a few other books. And if you ever have the chance to look at it or purchase one, the Cooper, Heron, and Heward book is an incredible resource. If you're looking in for anything kind of like behavioral-wise and interventions, there's a lot of data collection information in that too. So. All right, so the first thing I'm going to be talking about is a task analysis. This is actually one of my favorites because you get to really break down a skill. And sometimes there's certain skills that we think are super easy, like washing your hands or going to the bathroom. But some people think that, some kids, they think that those are really difficult tasks. They can be very daunting just to stand up at the sink and wash your hands. So these are, a task analysis is the breakdown of a complex task into more smaller teachable steps. So this is us helping the student and walking them through the task step by step. All right, so for this slide, I'm going to use a very simple example on this. And this is one for washing our hands, because we do see this a lot in the schools, and we want to teach kids how to, be, hygienic and clean your hands and keep germs away and things like that. So, and this can be used in numerous settings, especially like in the middle school setting. At my practicum placement, we have an ungraded life skills class, which this would be really good in. So for this slide, I'm going to give you an example of a task analysis and how it's used. The visual you see here is a typical one we use for kids in the school and in the home setting. So in my experience, I've had kids that get to the hand washing portion of using the restroom and kind of just stand there waiting for someone to prompt them on how to start this. If you're working with a child who is needing to learn to complete a task that may seem pretty unattainable to them, you can prompt them through each step to make them feel like this task is not so daunting. So, for example, you could say, okay, so the first step is, all right, buddy, we're gonna turn the water on. What's step 2? And then we prompt them to look for the second step. So we want them to make sure that they're looking for the next step, so that way they can eventually do this independently without our help prompting them, things like that. So the first step here is to turn the water on. You want to rinse your hands. Then you get the soap. Then we wash our we scrub our hands. A lot of times we like to tell kids to count to like 10 or 15, so that way they're making sure that they're washing appropriately. You scrub your hands. Then you wash your hands. You turn the water off, get paper towels, and dry your hands. The only thing this one is missing that I would like to see is to throw the paper towel in the trash. Other than that, this is a complete setup of an actual task that could be pretty hard for a student to be completing if this seems a little daunting to them. So this is a really great resource too. They have a specific section in the Cooper, Heron, and Heward book that specifically talks about task analysis and how to use it. So the next thing we're going to talk about is like what happens when your child seems to be mastering the actual material. So the book explains 2 main methods to determine if a child has mastered a skill. The first is the single opportunity method. This means that you will assess if the child can perform each behavior, emphasize each behavior, in the correct sequence independently. When completing this assessment, you would have the task in front of you without the child being able to see it, so only you could see it as the assessor. And then you would mark a plus for the task completed correctly and a minus for those completed incorrectly or omitted. The assessment would begin when you tell the child to complete the task without the analysis being in front of them to reference. So, for example, you could say, "Sally, please go wash your hands." At this point, you would observe the child completing the task and mark your responses on the sheet within a specified time frame. So you could give each task like a 6-second time frame. So that way you have the ability to say, okay, well, they're not completing this within a reasonable time. Because we don't want them just standing there using the soap or scrubbing their hands for like 30 seconds. That would be a little unnecessary. So you kind of have to put that specified time limit on it. And then you would say, so this could be something, for each piece, like I said, 6 seconds. And a lot of times we do, like I said before, we like to say, okay, but we need to scrub our hands with the soap for 15 seconds. That way we get proper washing. So the second method of determining mastery is the multiple opportunity method. And this method allows us to assess the child's level of mastery across all the behaviors. So before we were looking at each behavior, now we're looking at the whole set of behaviors in the task. If a step is performed out of sequence incorrectly or out of the time limit, the adult will complete the task for the child. So you full physical prompt them, and then you set them up to perform the next step correctly. And then you would mark the previous step as a positive mark. So it is a good idea to assess these over a course of 3 to 4 consecutive days. Now, when I was in the private practice in the ABA setting, we would do this over a course of a week, but I would have a kiddo for, 5 days, for 6 hours at a time. So we would actually do this for, we would do our mastery list. We would have a list of things that we would do, and then we would count that over a course of a week. And then I would go back the week after and only count it one day to see if that skill was actually pulled over and used again in the second week to determine any kind of mastery of skill. So in total, you can use either one of these to determine whether a student has mastered a specific task. So if they've mastered hand washing, then we can go back and we can say, okay, now what target behavior should we work on next? Maybe it's, packing up your backpack at the end of the day. That's a good one. So packing up your backpack at the end of the day can also be a very daunting task because you're like, oh my gosh, I have all this stuff to put in my backpack at the end of the day. I don't know where to start. So a lot of times we could make a whole task analysis and we could say, first we need to get our backpack, and then we would go on through each piece of the task. And then we would wait until they've mastered that and go through the process and do it all over again. And for each target behavior, we would do this. And a lot of times these are also very individualized. So yeah, the hand washing is kind of like, okay, it's in the bathroom and we can use it as reference. But like packing up your backpack, things like that, those can be really individualized for kids, which is really, really good. So. All right, guys, this is my favorite one. So you got to follow me because there's a lot of information on this one. So this one's going to be on differential reinforcements, and there's all kinds of different reinforcements that we can use. But this topic I would like to discuss is a kind of complex one, but very effective and the most widely known reinforcement to reducing problem behaviors. Sometimes we do this without even realizing it, but a lot of this is going to deal with extinction processes. So, and a lot of times we can do this, and it's just as simple saying something or reinforcing something verbally. That's simple. Some of this is as simple as that. So it's not like something you can't implement in the school or you can't use in a classroom setting. This is very, very applicable to a classroom setting, even in the gen ed setting. This is a great resource. So the first thing, a differential reinforcement, I'm going to talk about 4 of them. Technically, this is the concept of reinforcing one response class and withholding reinforcement for another response class. So the withholding of the reinforcement to the other response class is our extinction process. So they provide, each one of these will provide reinforcement contingent on either the occurrence of a behavior other than the problem behavior or the problem behavior occurring at a reduced rate. It also withholds reinforcement as much as possible for the problem behavior, which is the extinction process. Now, we're going to talk about a DRI, a DRA, a DRO, and a DRL. The first one is a DRI, which is differential reinforcement of incompatible behavior. Second one is a DRA, differential reinforcement of alternative behavior. DRO, differential reinforcement of other behavior. And the DRL, differential reinforcement of low rates of responding. All right, so here's where it gets really interesting. So there's a lot of information on this page, but it is such valuable information that you should really understand this in depth. So now let's take a look. And now that this can work for kiddos in the school setting, we also need to understand that how to individualize this too. So if we have a kid that's dealing with a problem behavior, we need to know how to take that behavior and individualize these 4 different methods and use it for that child, because it could be totally different for the kid on the other side of the school. So as for a DRI, this is when we're reinforcing a behavior that cannot occur at the same time as the problem behavior. So now let's say that we are working with a child who is still sucking their thumb in the 5th grade. Now, this is an actual situation because I have a friend who is now 27 and he still sucks his thumb sometimes. And he has no developmental disabilities or anything. This is just a habit that he's done his whole life and he never broke it. So, don't think that this is just a silly case that I'm coming up with. So here we would want to increase the likelihood of the person or a student doing things with their hands so that there is a less likelihood that they would be able to suck their thumb. So we could say writing. We'll use writing as an example. Once this happens, we would want to reinforce the incompatible behavior, which is writing, because technically you can't suck your thumb and be writing at the exact same time. This could also, another example could be, so we would be, with that one, we would be reinforcing writing and we would be putting thumb sucking on extinction, okay? So another example could be that a child is out of their seat all the time during class during the school day. We see this all the time, right? So here we would be reinforcing the child when they are sitting in their seat while we're putting the problem behavior of out of seat behavior on extinction. So we're only reinforcing when the child is in their seat and on, like, when they're sitting down. We don't have to worry about whether they're on task or not. We're only worried about them sitting in their seat because the problem behavior is them being out of their seat. Then once we get that under control, we can move on to being on task or not. Okay, so now we're going to move on to a DRA. This is when we are reinforcing a behavior that is more appropriate, that is a more appropriate alternative than the problem behavior. Now this one's a good one. All right. So this could be an example of a child using hand raising instead of shouting out during class. This is a really good school setting, application that we could use. With this, we want to put the shouting out behavior on extinction while reinforcing the more appropriate and alternative behavior. That's all we're doing. We don't worry about anything else. All we're worried about is putting the shouting behavior on extinction. You're not reinforcing that at all. But we are reinforcing when the child raises his hand. Johnny, thank you so much for raising your hand. I love how nicely you're raising your hand. Thank you for not shouting out, Johnny. I love how nicely you're raising your hand. Those are all labeled phrases that we could use to reinforce this and keep the shouting out on extinction. Perfect. Done. Simple. Perfect applied school setting. A more simple explanation, if you're working with smaller kids who are learning, language skills and things like that, like I've done this with my kiddos learning how to actually use words. So because I worked a lot with kids that did tantrum behaviors and all kinds of rough stuff like that. So let's just say you want a child to man for a cookie instead of tantruming. Instead of throwing themselves on the floor screaming and crying, we want them to man for cookie or whatever they have to, whatever their communication skill is. You would just using that as an example. If they sign for cookie, that's the more appropriate behavior. So we're going to reinforce that, and we're going to put tantruming behavior on extinction. Super simple. All right, now we're going to go into DROs. DRO is when we're reinforcing when there is an absence of the problem behavior for a specified period of time. So this one's a little bit more specific. So an example of this could be if you're working with a child who frequently interrupts you while you're talking or you're on the phone. You would reinforce the absence of interruptions during the specified time limit. I love how nicely you didn't interrupt me while I was on my 5-minute phone call. That was amazing. Those are really good. That's a really good labeled phrase that you could use with a student or a child. And then if we go into DRLs, this is a funky one. So DRL, remember, is the low rate, the differential reinforcement of low rates of responding. So this is the one where we're reinforcing the behaviors that are emitted less frequently than normal. So a really good example of this is leaving the room to go to the bathroom. That's a great example in the schools that we see all the time. We have all experienced that student who goes to the bathroom during a topic of study they dislike, like math, reading, writing, whatever it be. We've all experienced that kiddo. So we're going to reinforce the student for being in class more frequently than instead of going to the restroom or getting a drink in the hallway or going to their locker. So we're putting all that behavior, the more frequent behavior on reinforcing, and then we're putting the other behavior on extinction. So we're always going to be reinforcing the more time that the student spends in class. The more time they're sitting at their desk and being in class, like physically there, is what we're reinforcing here. So with all of these, there's some kind of reinforcing component, and then there's some kind of extinction component. So we always have to remember that, and it's super, super easy to simply do something like, hey, Johnny, I really like the way you're raising your hand. I really like how you didn't shout out. There's so many labeled phrases that you could use as a reinforcement, and use it as an extinction procedure as well at the exact same time. And some people don't even realize you're doing it sometimes. I kind of do this to John all the time. And, sometimes it happens, and, kids actually really realize that, oh my gosh, that makes me feel good. She notices that I'm doing something different. So this is something for me, I think is good because we're also pointing out good qualities for kids too, so it makes them feel good about themselves. That's why I like these so much, because they're so versatile, and then we can teach them skills like, hey, I like how you're sitting in your seat. That's something that you can generalize to another class period. Or maybe waiting at the doctor's office. The little kid realizes, oh, I sit in my seat at school and my teacher likes it. I should sit in my seat here. My mom would like it. Or different, my doctor would like if I sit here still, So they're learning to generalize these skills in a different context, and that is the best part of these. So I hope this wasn't too in-depth, but I hope that you guys learned a little bit about this. I know it's a little tough, but I thought that these were really good interventions to put in place because they're something simple that you can say in a classroom, and they're generalizable to a gen ed, special ed, whatever kind of setting you're in. Okay, so the last thing I'm going to be discussing is a social story. So this is a visual representation of an individual portrayed in a specific social situation that may present itself as difficult to that person. Now, the individual may have autism, and they may not, though this is an intervention is typically used for kids with autism. But we can totally use this for kids in the gen ed setting who just may be lacking a little bit of social skills. And not only is this used for social skills improvement, but it's also used to reduce problem behaviors in the school setting. So I don't want you guys to get the idea that this is just for kids with ASD and needing social skills. You can do that. You can use this for reducing problem behaviors and kids in the gen ed setting. So it's not limited. And then this is an interesting one because in 1991, Carol Gray created this concept of a social story, and she was like, I'm not having anybody take this. So she actually owns the term and the trademarks for it. So when I was in ABA, we used to laugh about this all the time. Just know that if you ever hear anything about Carol Gray, she's the lady for the social stories. So. Okay, another reason why I like social stories so much is because they're so creative, and of course I'm a crafter, so I love to create things, and I love to make things individualized for kids. We actually did one of these for one of the kids I worked with in ABA, and he was a teenager, so we did it like a comic strip because he was super into, I think it was one of the Avengers. I don't even know who it was. I think it was Iron Man. And we made this whole Iron Man comic strip for this kid. And we showed him how to use his social skills, because he would inappropriately walk up to people and hug them so he could sniff their hair. So we wanted him to try and stop that because it definitely isn't socially appropriate, but we were working on finding a different behavior that we could use instead of, walking up to somebody just to hug them and, get a quick sniff in. So we actually got him a little thing for his backpack, but that had a scent on it, so it kind of gave him a little bit, for that. But in the sense with the social story, we used, when it's appropriate to give your friends a hug, and when it's not. So that's how we did with the Iron Man thing. So that was kind of how we worked on that social story. But these, for example, these are typical formats. So these are the whole, when I'm in this situation, this is what I do. This is how I do it. This is why I do it. So these are the typical formats. And Carol Gray actually has this whole concept on her, the website. I don't like this name, but it's for autistic kids. That was part of the name of the website, but whatever. So part of that website specifically states what the different components are of a social story if you're making one specifically for a child. So if you're being creative and you're really trying to individualize this, you can go on that website and you can find all the different components that should be in there. So for this one, it's important to note that you can be, some of them can be pretty developmentally inappropriate for some students because you are working with students from all ages. We want to make sure that, we're not using, some silly cartoon for, 12th grader who's sniffing people's hair. You know, like we want to make sure, like we didn't want it to be weird for him. So in my situation, we actually used something he was into, which was Iron Man. It just happened to be an actual comic book person, superhero. So we used this whole Iron Man theme. And then we put him in the social story so he could see himself engaging in those positive behaviors. So, and then we put a little thingy on his little keychain on his backpack, like on the strap, that had like his mom's perfume on it. Or maybe, I don't remember, maybe we washed it. She washed it in her shampoo or something. But on his backpack, so that way instead of getting a sniff in, if you hug somebody, he could like sniff the little thing on his backpack. And it just kind of looked like a keychain to everybody else. So with this in mind, like, this gives a child an opportunity to see themselves being in the positive situation, engaging in the positive behaviors. So I'm going to talk about one study that I found, but a lot of this goes back to Carol Gray. All right, so this study discussed here used 3 students and provided them with social stories. The stories were individualized to the participant, which were targeted to show them using the appropriate social skills with their peers at school. So during their peer interaction, these social stories actually showed them using the positive behaviors during that school day. Now, it was interesting because there's 3 students. They all had ASD, but they did have verbal abilities and everything. So they could talk to their friends and communicate and everything. But the first child actually didn't show any skill improvement at all, which I thought was very interesting. But that child actually happened to be younger. So another reason why I like the social stories is because we can use these for our older kids. So not only can we use like the task analysis for our younger kids, but now we have an intervention that we can use with our older kids. Just like the 12th grader I had who sniffed hair. So we use that in specifically that was developmentally appropriate for him. So the other 2 participants in this study did show, the second one showed significant increase. He had the largest increase of all the 3 of them. And it was like, I think 57%. Let me double check here. Yeah, it was 57% increase. And then the third participant also showed, what is this? I don't want that. Also showed a significant increase, but his was only about 37%. But now, mind you, both of these second students were of older age. So they were like a little bit older. I think they were like 13 or 18. I don't have the study in front of me right now, but they were a little bit older. So like I'm saying, these students are like, you know, they see these visuals of themselves in the actual like social situation. And they're like, oh, hey, I can do that, you know? So it kind of changes that mindset. And that's what we're here for. You know, we have that mindset of, I don't know if I can do this, or like, I think this is what's socially appropriate. But now we have something that we can visually show the child with their face. Like, you can take a picture of them if you want. Like, if they're okay with it and you get the consent from the parents and everything, you can create them in the actual social story, which is actually what we did. Like, we put him, my client at the time, in the social story comic with Iron Man and all. It was actually really cool little intervention. There was about 3 of us who worked on it, but it was really cool. And that's why I thought it was interesting of this article, because the 2 older kids showed the improvement, which I don't think that it's not, you know, usable for some younger kids, but I do think that it's good for older kids. And that's kind of the purpose of me choosing this intervention, was because I wanted to give something for like older kids too, because sometimes it's weird if like you're using a DR in a classroom and you're like, hey Johnny, thanks for raising your hand, even though it's great for younger kids. We're like, dude, that's weird, you know, like, why is the teacher telling me I'm glad to raise my hand? So we just want to make sure that we're always developmentally appropriate, and we're working alongside with the kids and how they feel. We don't want to embarrass the kids either, you know, like we want to, you know, we talk about this in my ABA classes too, because we're like, we don't want them to be embarrassed by what they're doing, but we also want them to benefit from our interventions. So anything we come up with, we want to make sure that they're developmentally appropriate, they're individualized, and they're creative. That's the best part of it. And they can be involved in this process too. So always look at these and see how you can individualize this with a student. So for me, that was all I had. I hope you guys learned a little bit of my favorite part of life, some behavioral interventions. So if you guys have any further questions about any of the things I discussed, I'm more than happy to try and help you. and help you find some resources in the ABA life. So, all right.